Lap swimming and glaucoma, cardiorespiratory benefits versus goggle and head position issues. Swimming is an excellent low-impact aerobic exercise. For people with glaucoma, staying active is important because regular exercise tends to lower eye pressure and improve blood flow. In fact, studies show that moderate aerobic workouts like swimming, brisk walking, or cycling significantly reduce intraocular pressure, IOP, in both healthy eyes and glaucoma patients. Lowering IOP and improving blood flow to the optic nerve helps protect vision. Swimming also builds heart and lung health with minimal stress on joints, making it a great choice for older adults or those with joint pain. However, swimming has some unique eye-related factors. Tight-fitting goggles, the face-down posture of freestyle, and chlorinated pool water can affect the eyes. In this article, we review the evidence on how lap swimming affects IOP and ocular blood flow. We compare the stroke styles, freestyle, backstroke, breaststroke, weigh the cardio benefits against any risks, and offer practical tips on goggles and technique. For anyone with glaucoma or at risk, the goal is to swim safely and enjoy the health benefits while minimizing eye stress. Aerobic swimming and eye pressure. Swimming is aerobic exercise, so it shares the general benefits of workouts. Numerous scientific studies report that aerobic exercise lowers eye pressure. For example, a clinical trial found that 30 minutes of moderate treadmill running significantly reduced IOP in primary open-angle glaucoma patients, as well as healthy subjects. The study used advanced imaging to show that exercise actually expanded the eye's drainage channels and let fluid out more easily, which explains the pressure drop. This effect is temporary. IOP usually returns to baseline after stopping, but regular exercise habitually lowers overall eye pressure. Lower and more stable IOP is a key goal in glaucoma management. In fact, large body of research confirms that both chronic high IOP and frequent pressure spikes are risk factors for glaucoma progression. So, advocating aerobic exercise like swimming is in line with maintaining healthy eye pressure over time. Swimming also increases heart rate and blood circulation, which generally helps deliver oxygen and medication to the eye tissues. Importantly, water exercise is low impact. The buoyancy of water cancels most weight load, making swimming accessible if you have arthritis or joint issues. An exercise review notes that the resistance of water reduces stress on joints and muscles, so older adults often find pool workouts comfortable. This ease of movement means people are more likely to stick with swimming long term. For glaucoma patients or at-risk individuals, staying fit and reducing sedentary lifestyle is vital. In summary, the cardiovascular and metabolic benefits of regular swimming, improved fitness, circulation, mood, etc., are overwhelmingly positive and can indirectly support eye health. Swimming goggles and eye pressure. While the cardio benefits are clear, swimming has potential eye-specific downsides, notably wearing tight swimming goggles. Most goggles form an airtight seal around the eye socket. This seal puts gentle pressure on the tissues around the eye, and research has shown that even modest compression can raise IOP. For example, a Korean study measured eye pressure before, during, and after putting on standard swim goggles. They found that IOP rose from an average of about 11.9 mm/Hg baseline to 14.2 mm/Hg immediately after donning the goggles. That 2 to 3 mm/Hg jump was statistically significant. The pressure stayed elevated as long as the goggles were on, and then dropped right back to normal once the goggles were removed. In practical terms, glaucoma patients often worry about even small pressure increases. The study authors noted that elevation of intraocular pressure is an important risk factor in the progression of glaucoma, and that our findings about goggles should be considered for safety concerns, especially in advanced glaucoma patients. A more recent study in Scientific Reports, 2024, also confirmed this pattern. Volunteers wearing typical tight goggles had a significant acute rise in IOP during wear. Their eye pressure was measurably higher after 1 to 10 minutes with goggles on, then returned to baseline right after removing the goggles. Importantly, these changes were short-lived. No lasting damage was seen in the eye's anatomy over the brief period, but it shows that any goggle use causes a transient spike in pressure. Another study drilled a small hole in one side of the goggle to eliminate suction altogether. They found that the normal goggles, without vents, lifted IOP by about 3.3 millimeter Hg from 17.7 to 21.0 millimeter Hg in just 2 to 5 minutes, with the hole breaking the airtight seal that spike did not occur. The authors warned that the common eye gasket-style goggles can exert enough pressure to raise IOP and may produce negative effects on eye health, especially in patients with eye disease. Beyond the numbers, goggles also change ocular hemodynamics, blood flow. In one study, wearing goggles caused the ocular pulse amplitude, a measure of blood flow in the optic nerve head, to rise, while the ocular perfusion pressure, blood supply to the eye, dropped slightly. These shifts in blood flow dynamics happened in tandem with the IOP rise. All these changes were temporary, returning to normal after removal, but they highlight that tight goggles disturb the delicate eye environment during wear. What does this mean for swimmers with glaucoma? The good news is that the pressure spikes only last while the tight goggles are on. Once removed, IOP falls back. However, patients with glaucoma or other eye conditions may want to limit even these short spikes. One practical tip is to choose goggles that are as gentle as possible. Experts recommend using loose-fitting, large-volume goggles rather than small, highly tapered ones. A looser fit means less suction on the eye. Some swimmers even use vented or split-frame goggles that avoid a perfect seal. In fact, that drilled goggle study suggests that eliminating the vacuum effect prevents the IOP rise. So, swim goggles designed to relieve pressure, or simply fitting them less tightly around the orbit, can mitigate this issue. It's also worth noting that wearing goggles has another benefit. They protect the eye's surface from irritation. Pool water contains chlorine and chloramine, the byproduct of chlorine plus contaminants, which can sting or dry out the eyes. Gentle goggles keep the water and chemicals off your eyes. Key point: a comfortable pair of goggles is recommended for swimming with glaucoma. But make sure the fit is not too tight. You should not feel squeezing around your eye. Stroke and head position considerations. In lap swimming, the three main strokes, freestyle, front crawl, backstroke, and breaststroke, position your head differently in the water. This affects how gravity and water pressure influence eye pressure and comfort. Freestyle, front crawl. In freestyle, your body is face down and your head dips into the water between breaths. This face-down, prone posture is similar to lying flat on your stomach. Multiple studies of posture show that even a slight head-down tilt can raise IOP by a few millimeter Hg. For example, a controlled experiment tilted subjects 10 degrees head down and found IOP jumped 3 to 4 millimeter Hg in seconds. Another study comparing sleep positions found that lying face down significantly increased IOP, more than lying on either side. The takeaway is that being face down tends to elevate eye pressure. Thus, during long freestyle sets, when your head spends extended time underwater or turned down, transient IOP could rise. Breaststroke. This stroke typically keeps your head above water each time you breathe. You lift your head forward on each stroke cycle. This means there are smaller intervals of head-down posture compared to freestyle. It's generally easier to keep the head and eyes mostly above water. The repeated motion of bobbing is gentle on the neck, and the face is only briefly submerged. Breaststroke may cause less sustained head-down pressure than freestyle. However, if you dive forward underwater at the start of each lap, that initial dive can still create a quick pressure spike similar to any face-down position, though it's brief. Backstroke. In backstroke, you lie on your back, face up, the entire time. This is essentially a supine position. Interestingly, a fully supine position, lying on your back, raises IOP compared to sitting, but usually less than a prone position. In any case, backstroke keeps the eyes mostly above water and avoids the head-down angle. The main disadvantage is you still often wear goggles to see the ceiling cues and rely on them fairly tightly. But because your head is tilted up, water does not press on your eyes. For glaucoma safety, backstroke has a clear advantage. It minimizes any prolonged downward pressure on the eyes. Stroke choice advice: if eye pressure spikes are a concern, alternating strokes can help. Many glaucoma specialists suggest doing more backstroke or breaststroke laps and less straight front crawl. You can still get a great cardio workout. Backstroke is even a bit more demanding for shoulders and core. If you prefer freestyle, try to keep breaks to breathe and avoid sinking your face too long underwater. In short, freestyle sessions, head down, can transiently raise IOP more than backstroke, head up. So swimmers with glaucoma who are worried about eye pressure might favor strokes that keep the face above or level with the water surface. Chlorinated water and eye irritation. Aside from pressure issues, pool water itself can irritate the eyes. Swim pools are disinfected with chlorine, but chlorine combines with sweat, urine, and dirt to form chloramines. These chemicals often cause swimmer's eye, redness, itchiness, and dryness. Swimmers frequently report stinging or bloodshot eyes after a day in the pool. Goggles will prevent most water contact, but if any water leaks in, irritation can occur. Even eyes without glaucoma can suffer from pool chemicals. For someone with glaucoma or recent surgery, maintaining a healthy ocular surface is important since chronic irritation can indirectly stress the eyes. Good practice: always rinse your eyes with fresh water or saline after swimming, even with goggles. Lubricating drops can help if eyes feel dry. The Centers for Disease Control notes that red, itchy eyes are a common symptom when swimmers are exposed to chlorinated pools. Overall, this is a minor issue that goggles mostly fix, but worth knowing. Swimming after glaucoma surgery. If you have had glaucoma surgery, like a trabeculectomy or placement of a drainage tube, extra caution around water is needed. These procedures create a small bleb or opening in the eye wall to drain fluid. In the weeks after surgery, that bleb is very delicate. Getting water in the eye could introduce bacteria into the eye, risking a serious infection called bleb-associated endophthalmitis. Ophthalmologists emphasize that any infection in a post-surgery eye is very dangerous because germs can enter through the surgical site directly. For this reason, surgeons usually advise patients to avoid swimming for at least 4 to 6 weeks after surgery. During the initial healing, it's best to skip pools or hot tubs entirely. Once your doctor gives the all clear, usually after confirming the bleb is functioning and sealed, swimming can generally be resumed, but with caution. Even years later, patients who swim are told to use goggles religiously and to avoid any dirty or stagnant water. The patient information emphasizes, post-surgery patients are encouraged to always wear goggles during swimming and avoid swimming in unclean waters. Goggles and even a clean swim cap or waterproof bandage over the eye can help keep contaminants out. If you ever notice pain, redness, or discharge after swimming, see your eye doctor immediately. In short, after trabeculectomy or tube shunt, being extra careful with water, pools, lakes, even shower spray is important until fully healed. Recommendations and verdict. So, should glaucoma patients swim? The balanced answer is yes, provided certain precautions are taken. The benefits of swimming as a low-impact, full-body aerobic exercise are substantial. Regular swimming can help lower intraocular pressure and boost circulation, contributing to better glaucoma control. For most patients, moderate swimming is safe and encouraged as part of a healthy lifestyle. To minimize risks, use goggles every time. They protect from chlorine and help keep water out of the eyes, but choose low-pressure goggles if possible. Look for ones with a larger eye cavity or vents. Avoid sealing them extremely tight. A gentle, snug fit is enough. Some swimmers cut small holes in goggles for training to eliminate suction. In fact, researchers found that without an airtight seal, the goggles no longer caused an IOP spike. Even without modifying your goggles, simply try not to over-tighten the straps. Periodically release them during rest breaks if safe to do so. Choose your stroke. If your glaucoma is well controlled, one stroke isn't strictly forbidden. However, if you are concerned about pressure, favor backstroke and breaststroke since the head stays level or up. These strokes will reduce the time your eyes spend in a down tilt position. If you do freestyle, keep head rotation symmetrical and take regular breaks to breathe. Avoid sustained head down drills. In other words, minimize prolonged periods facing down. Mind your head motion. Avoid excessive force pushing off from the wall or diving head first if your eyes are closed or uncovered. Sudden water pressure during a strong underwater push can transiently spike IOP as well. After surgery, delay swimming until your doctor says it's safe. Once you return, be extra diligent. Wear goggles at all times and stick to clean, chlorinated pools. Skip natural bodies of water, lakes, rivers, oceans, which can harbor germs. Post-swim care. After each swim, flush your eyes with fresh water or sterile saline. Lubricating eye drops will wash out chlorine residue and soothe any irritation. In conclusion, swimming can be a valuable exercise for eye health, but comes with caveats. Studies indicate that the IOP spikes caused by tight goggles or head-down swimming are brief and reversible. For most patients, these temporary increases are outweighed by the long-term benefits of staying active. By using properly fitting, low-suction goggles and choosing strokes that keep the face up, glaucoma-conscious swimmers can enjoy the pool with less worry. In the words of eye experts, swimming is a very interesting and beneficial physical activity for glaucoma patients, as long as precautions are observed. All links to sources are available in the text version of this article. You can find the full article at visualfieldtest.com. Thanks for listening. To check your visual field, click the link at the bottom of this article or visit visualfieldtest.com.